Okay, we're going to find the distal radioulnar joint and extensor digita minimi. So the way to do that is just by simply looking at the dorsum of the radius and ulna and find that joint. So you can see the ulna sticking out here distally, and that's where we're going to put our probe. Now when we do that, we can immediately see that we're overlying that distal radioulnar joint. So when I demonstrate that, and I'll show you that now. You can see the ulna here, and then the radius is here. So the radioulnar joint is just that particular joint. Now, if we then also identify the extensor digita minimi, we can then do that by extending the little finger, and you can see that then lying exactly over that distal radioulnar joint. So that's basically how you find it. Pretty straightforward, and that's the way to do it.